Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Okay, Michael, tell me what's going on with your back. What happened?
Oh, it's just when I'm twisting
Mm-hmm.
and when I arch my back.
Mm-hmm. You have back pain.
Yes.
So how long and how did you hurt your back?
I had for about 10 years.
For about 10 years. Did you have any injury, accident, trauma,
No,
or anything
just,
like that?
You know, habit.
Habit. Slouching or sitting for a long time. Okay. So, how much pain do you feel there from 0 to 10? 10 is emergency room, and what caused the pain?
Probably like around 4 or 5.
4 or 5. And what make it really worse?
Well, when I'm twisting
Twisting?
and when I arch my back.
When you arch your back. Okay, so for the last 10 years, what kind of treatment you had for your back?
Just massages.
So you had massages. Did you have any other treatment like chiropractor,
Oh, yeah.
acupuncture, or
Once in a
physical
while.
therapy?
I'll have a chiropractor and a physical therapist.
Okay. So so now to aggravate your symptoms, we'll have you just do some motion. Is that correct?
Yes.
So we'll have you do the motion now, and I want you to tell me from 0 to 10 how much pain and where do you feel the pain, okay? So we'll have you stand up here. And we'll have you try to touch your toes and tell me how that feel.
Okay.
Any pain with that?
Yes, my hamstrings.
Your hamstring.
And
What
calves.
else? Your back.
No.
No. Okay, so let's extend backward.
Yes.
How much from 0 to 10?
Like around 4 or 5
And where do you feel it?
on my lower back.
Your lower back. Any sharp pain going down to your legs?
No.
Okay. So twist left and right. Side bend.
Yes, right here.
0 to 10.
About 4 or 5.
And the other side.
Same thing.
Okay. What about twisting like this?
Yes, on my left.
The same thing. Okay. So those motions. So we're gonna use those motions for testing. Okay. You're comfortable lying on your stomach?
Yeah.
Okay. Let's lie on your stomach, head over there. Is there one side more than the other side,
No,
or
they're both the same.
They're both the same. Okay. So we'll have your head here. Make sure everything pain-free. Okay.
Yes.
So you had a lot of massage.
Yes.
Man, okay, so you will tell me after the treatment what the difference between massage and ASTR, okay? Okay, so your pain most likely in here, that's
Yes.
correct? Okay. Not going down to your glute or just in this area?
No, not today.
Okay, but sometimes it goes down
When I'm sitting down, yes. When I'm at work, it goes down to my glutes.
when you work.
Yeah,
Okay,
that's
and
it.
you say that you're driving, yeah?
Yes.
Okay, so you can scoot up and just put your head down. So it goes down to your glute in the hamstring or just a sub-by glute?
It goes up to here.
Okay, so long sitting, it's aggravated you.
Yes.
Okay. Alright, so make sure what I'm doing is not painful, okay?
Sure.
How's that feel?
About 3 to 4, like 3.
Make sure what I'm doing is not painful.
Okay.
Okay. You feel this movement? This is normal fascia movement. Fascia is, the superficial fascia layer is like a wrap surrounding the entire body. Very thin layer, excuse me, very thin layer that's wrapping the entire body like a Spider-Man suit. So when you have fascia tightness, it's like you're wearing a t-shirt 2 to 3 sizes too small. It should move like this. Feel that?
Yeah.
That's not moving. So when your fascia is tight, it's compressing everything underneath it. So you're gonna release that, but make sure it's not painful, okay? Okay, gonna feel cold. I'm gonna work on the scar tissue and I'll show you how much scar tissue you have there, okay?
Sure.
You feel those bump here?
Yeah.
That's a scar tissue. If you don't have a
It's
scar
built
tissue,
up? Or is am I right? It's built up there. You need to
Yes.
break it? Okay.
yes. So you know, like if you, the way we get the scar tissue, it's either if you have an accident, trauma, we know what happened. if we don't have really clear history, it's usually over time from bad habit, like
Yes,
poor
bad.
posture, poor body mechanic. Every day you build, you cause a micro tear, so your body build a layer of scar tissue, but over time you ended up with a scar tissue that's 50 layers or something like that. And you can see those bump or rocks in there. And that's because our muscle should act like a rubber band. When it contracts and relaxes, it should stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when the muscle contracts, it's not really going much. That's why when you try to go back or twist, you start to have that muscle spasm preventing you from doing that range of motion. Unfortunately, it's hard to break it with the massage because how many massages do you have like per week? How many times?
a week.
2-3 times a week. It's hard to break a scar tissue with the massage, with the hand. You have to have a tool. It's hard mechanically and physically to break it. That's why I invented those tools. Because with massage, even based on the studies, yeah, you're gonna feel better temporarily, 1 or 2 days, and the study shows that, but it does not carry on, you know?
Yes.
So we have this type of treatment. But the thing is, we wanna really get rid of that knot, so you don't have to have those frequent treatments. Does that make sense?
Yes, sir.
And you can feel, like here, it's not too bad, but when we get here, that's like a piece of rock here, but make sure it's not painful, okay? And you feel this big knot here. Make sure it's not painful, okay?
No.
Sorry.
No, it's okay. No.
It's not painful?
No.
Mm-hmm. But most of it, like around your glute by the iliac crest here.
Where it's built up.
Yes, it's probably like when you sit, you're just
Yes,
sitting like
all
this.
of that.
So you strain this area, you build more scar tissue. That's why. So after this video, we're gonna go over the right way of doing things, so you don't build the new scar tissue from bad habits. That's why it's very important. You know, the treatment will break the scar tissue or release the tightness, but if you go back do the bad habit, you're gonna build a new scar tissue. That's why it's important for patient actually to complete the entire program, because I go over behavior modification that actually will decrease your risk of having this issue in the future and ergonomic. If we don't do that, the treatment will not be enough because the trigger still exists. Does that make sense?
Yes, sir.
Make sure you tell me if it's too much, okay? Have you had any surgeries or
Never.
anything? Okay,
No.
that's good.
Thank God. No.
That's good. Stay healthy, okay? And young. You feel this one here? And you can see it actually. Look at this. Feel this? Feel that bump here? Yeah. Sorry, I got in your... Do you have any issue here? Up?
No.
So it's mostly down here, yeah? Alright, so I'm gonna clean this up, and we're gonna bring you some water, and I want you to tell me how you feel. Drink some water, and we're gonna do the exact same motion that was aggravated, and you will tell me how that feels. Okay, let's set up for me, please.
I need that tool on my Gillis.
What?
I need that tool.
Yeah, we're gonna work on that for sure. We're gonna
I
work
can
on
tell
that.
already.
Yeah. Definitely we're gonna work on that. So we're just focusing on the back for now. I wanna take care of that, so we definitely can work on Achilles, plantar fascia as well. A little bit more water for me.
More?
Yep, please. So we're gonna do the exact same motions that aggravated, and you tell me how that feels. So we bend forward, backward, twist left and right, side, and tell me how that feels. How's that?
Okay, that probably like 2
Where?
on the hamstring. It's not as pain.
I'm gonna work on the hamstring.
Yeah.
Okay.
Oh, okay.
What about the back?
Oh.
Nothing? Twist left and right. Side bend.
Just a little bit, or
Where?
no, no more. I
Any pain in the back, or the back pain is gone?
No, it's gone.
It's gone. It's just a tightness in the hamstring. We can work on that. Okay, what is in the hamstring?
Oh, just remember when I.
Where do you feel it? What area in the hamstring?
Right here,
Both of them?
here.
Okay. Can you roll your pants up to work on the hamstrings?
Yeah, of course.
And take your both of socks off. Tell me, hamstring here?
Yes.
Or upper high, or just hamstring? Okay. Man, you're tight.
Yes.
Feel those? Those big scar tissue here.
Ah,
Man, okay.
that's what my.
Let me know if it's too much, okay?
Yeah.
How's that?
Nothing. I mean,
If you feel pressure, that's
Yeah.
fine, but
Yeah,
pain is
I
not
just-
fine.
I just feel pressures.
Okay.
I need to change my shoes, I guess.
Yeah, we're gonna go over the shoes option after the video. The right shoes,
I wear a lot
the
of,
way you walk, you know what I mean?
Oh, that.
I'm gonna go over the proper way of walk, because if you walk incorrectly, you're gonna build a lot of scar tissue. So it's important to work on ergonomics and body mechanics
Yes.
and proper shoes, orthotic or some stuff like that. Because all of that contribute to issues, could cause issues.
Yes.
If you wear in the wrong shoes, if you walk in incorrectly, we'll go over your sleeping posture, your ergonomic driving, computer posture, phone posture, and all of that, because we want to make sure that you don't do anything cause triggers.
So what does it do that too?
Hmm?
What does it do that too? It releases the.
So I
Okay.
do release deep fascia with it.
Oh, okay.
I will never be able to go that deep with my fingers or knuckles, and that's what we learn in school. So I invented this tool to really be able to go that deep and release the deep tissue. And actually, I will tell you how much I'm going there. You see this black part?
Okay.
I go deep,
That's about.
double that space, deep in there. You cannot see it, but I can.
Right.
That's how far it can go. With the hand, it's hard to really go
Yes.
that deep to do deep release. Does that make sense?
Yes, sir.
So I will show it to you here. You see how deep it's going?
Yes.
Okay. So it's double the black.
Oh wow.
You see it?
Yeah.
I'm putting my hand here to stabilize it, but it's the black here. You see the other tissue here, in here.
Okay.
You see?
Yeah.
That's how deep it's going. Double that space. So I'm going deep by a very good inch deep in the
Yes.
tissue. You feel that, yeah?
Yeah.
But the problem with using our hands to do soft tissue release, mechanically impossible to go that deep.
Yes.
That does not make sense. Even they taught us in school, use your knuckle, use your elbow. I'm like,
Yeah, that doesn't
what you doing? Nothing. Just so that's why I invented this tool to be able to go that deep to release the tissue, as long as you don't feel pain. Okay.
Yeah.
Feel that grinding here? Is that painful?
No. It's a lot of grinding.
Yes. So when you don't have a scar tissue, this is grinding here too. It should be like what you feel in the back, like going over smooth area, nothing, no grinding. So this is feel like I'm going over a washboard. And I hear the sound. I don't know if you can hear it, but you can hear the grinding of the scar tissue. And if I do it slow, you will notice it's actually going like this on the scar tissue.
Like speed bumps.
Yep. And here, that's a big knot here. See? Sorry.
No,
Too much?
No, that's fine.
Well, you're a tough guy. You're getting deep massage 2 or 3 times a week. I can't believe you do that. I don't recommend deep tissue massage, by the way, because it could cause a lot of inflammation. If you want to do massage for wellness, Swedish massage,
Nothing.
not the rough deep, because if they're really aggressive, you're gonna cause tear in the muscles.
No, just Swedish sometimes.
Yeah, that's fine for wellness, but it's not gonna break the scar tissue. I'm just doing this because of the camera, but I probably will turn him over, but I just want to get this quickly. It's not the best mechanic for myself, but it's okay. Is that too much? Here, feel that? Sorry. Any pain with that?
Little bit.
Sorry, make sure you tell me if it's painful, okay?
But I can handle it.
No, no, no.
Okay.
Because
Okay.
think about if you have internal inflammation,
Okay.
do you want to rub over open wound?
No. Yeah.
Because you're going to make it inflamed more. If you have inflammation internally, we don't want to really be aggressive.
No.
We'll be gentle. Okay, so I'm gonna clean up that. We'll have you drink more water, okay?
Sure.
And then we'll do the same range of motion and tell me how's your calf, hamstring, back, everything. Okay, so let's sit up. So we're gonna do bending forward, backward, the same exact range of motion. How's that? Hamstring and calf?
Probably 2. Still painful.
Where?
On the same spot.
Where is exactly?
Which calves and
Where in the calf
hamstrings.
and hamstring?
Right.
Right in here and
Yeah.
there. Okay. Backward and twist. How's your back? And twist left and
Better.
right. Okay. So the
That's twisting no more. It doesn't hurt.
so the problem now is in your calf and hamstring, and those two spots in both sides. Okay.
Yeah.
Okay. So let's lie on your back. Remember when I was talking about proliferation and inflammation? I'm gonna go to the inflammation protocol now. Any seizures or pacemaker?
No.
Okay. So let's lie on your stomach. So I'm gonna work on decreasing localized inflammation there. Where is the exact spots?
Right here.
The whole area, or
Here.
it's
Just here. Here and
both sides?
Yeah.
I'm not surprised with the amount of scar tissue you have. Those scar tissue actually very thick. That is the thickness of your calf. So I'm gonna do this. If it's a mild inflammation,
okay.
that should be using the magnet for a few minutes should be enough. Okay. So now we're gonna know how much inflammation you have there. So if it's mild, you wanna see how strong is this?
Wow.
So this is not your refrigerator magnet. It's very strong. So that's what I use. I invented this to work on inflammation. If it's mild inflammation, just a few minutes of using it should be enough. Severe inflammation, a few
So
minutes is not going to
like-
be enough.
What does it do to the scar tissue?
It's working on inflammation.
Oh, okay.
So when normal cells voltage runs between 20 to 25 millivoltage, okay? When they measure the voltage of inflamed or injured cell, they found that voltage runs between 10 to 5 millivoltage. So think about this way. You're running on 5% of your phone battery. You're barely making phone calls. So that's the same thing happening. When you have inflammation, your voltage is 5 to 10. Your body's not moving from inflammation to proliferation to maturation, that normal healing cycle. So how to correct that? We already know that cells use electromagnetic currents to communicate. So I invented this tool with very strong magnet that increase the voltage in the cell. So we try to transition it from inflammation to proliferation to maturation. And I coat it with anti-inflammatory coating to speed this process to really transition to proliferation and maturation. So that's, and it's very strong, but when we measure it, it was like the range of the field was like 2 inches to 2.5 inches. But I'm using with you two magnet to penetrate 4 to 5 inches deep. So if it's mild, you should feel better after this. So we will know how bad the inflammation in your calf. This is not a holy water, just water to help flush toxins out. Okay, so let's do the range of motion again, and tell me how you feel. How's that? And backward. Did you feel it, or this was gone?
Backwards, no more.
Okay. Twist left and right. How was the bending?
Not as, still painful, but not as much.
0 to 10?
Like 1.
1?
Yeah.
Let's drink more water. I will try it again.
Okay.
So it went down to 1.
Yeah.
The calf, how much when we start? I know you, the back you said like 4
The
or 5.
hamstrings, no more. It
The
doesn't-
hamstring. So you feel it in the calf now
Yeah.
only? Where?
Lower now, like around here.
Is it 1 spot or 2 spots?
Just here.
On this side only?
Both sides.
Both sides. Okay, so let's try. Drink a little bit more water. Want you to try it again and see. If you still feel it, I will try to use a magnet one more time. Okay? But your calf is fine. So that's give us information that you have less inflammation in the hamstring and you have a little bit more inflammation in the calf.
Yeah.
How's that?
I just feel like tight.
But the pain.
Pain, no. It's just tight.
I expect the tightness because you still have a scar tissue, so it might take us a few treatment
Right.
for that.
I think it's tightness.
It's tight,
No
it's
more
not pain.
No.
Okay, so let's move around one more time and tell me how you feel. What I care about is the pain. The tightness,
Right.
I expect you're gonna continue to have the tightness because that scar tissue very thick, so it's just gonna take us a few times to really clear it up. So let's bend forward, backward. You can come here.
Yeah.
And turn around. Okay, so we'll have you bend forward, backward, and twist and see how that feels.
Sure. Yeah, no more pain.
No more pain. Backward. Okay. Side bend, left and right.
No.
You see, you're moving faster now. Look
Yeah.
at this. Yeah,
Yeah.
yeah. So, what do you think about ASTR treatment? You had massage forever,
Yeah.
so, and you had chiropractor. So, can you tell the difference?
It's yes.
Yeah.
It's fast and
Mhm.
effective.
Yeah, awesome. Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!